Over to you, Dr. Cloete.
So thanks a lot, Wayne. Is it going into presentation mode?
Yes, thank you.
Okay, perfect. Thanks a lot. Thank you as well, Wayne, for sharing all the activities that the Department of Health are currently driving. So from veterinary services side and Department of Agriculture, Land Reform and Rural Development, I'll just be giving an overview of how veterinary services is structured and how we participate in One Health activities and what we drive from our side. Also keeping in mind that with all the reporting structures like the International Health Regulations, JEE, National Action Plan for Health Security, we participate in those activities as well that are driven by the Department of Health. So just to give you a brief description of veterinary services, we're the custodians and implementers of, firstly, the Animal Diseases Act, which provides for the control of animal diseases and parasites, and these are to promote animal health and any matters connected therewith, and obviously subsequently it affects human health and food safety and security as well. And then we've got the Meat Safety Act of 2000, which provides for measures to promote meat safety and the safety of animal products. You'll see that we're also implementers of several other acts, Animal Protection Act, Performing Animal Protection Act, the Vet and Paravet Professions Act, and also the Animal Identification Act. So these all influence our jobs, and we are sometimes directly responsible for the implementation thereof. If we look at the organizational structure of veterinary services, we need to remember that this is a provincial competency as per the Constitution of the Republic of South Africa. So we've got a national office and we basically have 9 provincial offices. We look at the national office, so that's DALRRD. We've got a Minister and Director General. We've got a Chief Director of Animal Production and Health, which is our Chief Veterinary Officer. This is Dr. Murisani. We've got a Director of Veterinary Public Health, which is Dr. NOHF, and then a Director Animal Agile. Then for the 9 provinces, for each of the provincial departments of agriculture, we've got a MEC and also the head of department. And then you might either have a Chief Director Veterinary Services or a Director Veterinary Services, just depending on the provincial Department of Agriculture structure. Usually it's your national office that's more responsible for policy development and setting up SOPs and action plans, and your provinces are typically the implementers of legislation and policies. But then other structures that also form part of the broader veterinary services is the ARC OVR, Onderstepoort Biological Products, the South African Vet Council, DALRRD Agricultural Inputs Control, also known as Act 36, and then also the newly formed BMA. When it comes to veterinary programs that we run in the country, probably the ones that are most well known from an animal health point of view is the National Strategy for the Elimination of Canine-Mediated Human Rabies in South Africa. We've also got the Bovine Brucellosis Scheme and the Bovine Tuberculosis Scheme. When it comes to vaccination of animals, we do have some vaccines that are compulsory in the country. So firstly, anthrax, so all cattle need to be vaccinated annually. Brucellosis, all heifers 4 to 8 months of age must be vaccinated. And for rabies, all dogs and cats in the Republic must be vaccinated. So you'll see for the 3 compulsory vaccinations that we have in the country, all 3 of these cover for zoonotic diseases. So obviously aiming to promote animal health and to promote human health as well. Then we also have residue monitoring programs. So we're looking at chemical residues at abattoirs as part of our national monitoring program. We also look at antimicrobial resistance. So we've got an active surveillance program that is due to commence. And we've got several parties that are involved here. So the National Department of Agriculture, your BMA, ARC, OVR, etc. We do have passive surveillance data that's available, but unfortunately not collated at this point in time. We also have our meat safety programs, in which all abattoirs, import and export cold stores, cutting plants and processing facilities to comply with, and they're under official veterinary control and monitoring compliance specifically to the Meat Safety Act. Okay, so then I would just like to look at a case study of joint activities. When it comes to veterinary services, like I said, implementation plans are usually developed at national level with input from the provinces. Veterinary services and your human health services work together at all levels, so national level, provincial level, and local levels, especially when outbreaks need to be managed. We can look at recent examples of the listeriosis outbreak, foot and mouth disease outbreaks. Typically, environmental health will become involved with carcass and waste disposal. And this we've seen on a much larger scale with the recent highly pathogenic avian influenza outbreaks. Then we also conduct awareness campaigns together, typical for brucellosis, TB, Rift Valley fever, anthrax, meat safety, etc., in local areas. So this is typically your officials on the ground that conduct these campaigns. And in many areas, we also host joint awareness campaigns to promote the One Health approach. And we typically do this with Rabies Day that's in September. It's not limited to rabies, but it's sort of probably one of the biggest topics that we cover with a proper One Health approach. And then, of course, we also have food safety management programs and occupational health and safety that we focus on. Okay, I'm just also specifically going to look at rabies. This is probably the best example that we have of One Health collaboration in the country. We've got a very, very active national rabies advisory group. We've got fantastic collaboration from all the provinces, from veterinary and health sectors. Environmental sector also plays a role, especially at a national level. And I really must say that this is a very pleasant group to work with, and everyone pulls their weight as well. So provincial veterinary services are responsible for vaccination of dog populations. So they focus on communities that typically cannot afford vaccination of their dogs and cats, and they conduct awareness campaigns as well to inform people about this disease. They're responsible for reporting outbreaks in animals and also responding to these outbreaks, and responsible for liaising with animal owners and to engage with health authorities if required. For example, if you get an outbreak of rabies in animals and you know there've been some human exposures. We have a few provinces that have provincial level rabies action groups, which focus on One Health. And in these provinces, you can really see in terms of how quickly they can communicate with each other and get help from one sector to another. These provincial and local level action groups work really, really well. And we're sort of encouraging the members of our rabies advisory group in all provinces to help establish these groups, just so that you can know who to contact when things get a bit tough and when we've got outbreaks to deal with. Then also, we don't just have participation from the state side, we also have our private veterinarians and animal welfare organizations that also vaccinate and create awareness. This is often done at a cost, but they play a very, very vital role to reach people and also animals that veterinary services from government side can't always cover. Okay, then when it comes to provincial health services in response to rabies, they ensure that health facilities have human rabies vaccine and rabies immunoglobulin available. If people were exposed, they need to be treated. They're responsible for patient risk assessment and subsequent rabies post-exposure prophylaxis treatment. They also play a massive role in conducting awareness campaigns, and they're able to reach a lot more people than veterinary services can, just because they've got a much bigger structure. And they're also responsible for reporting outbreaks in humans. Obviously, they communicate this to veterinary services as well, so that you can have an outbreak response in both the human sector and the animal sector as well. Communication when it comes to rabies is currently very well done at national level, and provincial and local level is actually very well done as well. We often see on-the-ground responses, especially from Eastern Cape and KwaZulu-Natal, where health and veterinary services have worked together extremely well in helping people, in helping animals. So there's really a very, very good collaborative effort that's going on. So altogether, our national rabies strategy has that joint goal of 0 dog-mediated human rabies deaths by 2030. The provinces have also developed their own provincial rabies strategies that speak to the national strategy. It's just because your risk is different in each of the provinces, and they have their own structures for implementing disease control. So far, we've had very good response from the provinces. We know where our problem areas are, and we need to focus our efforts. So this is an ongoing effort from health and veterinary services side. Okay, so then just lessons on collaboration from veterinary services. Really, really important is effective communication. You need to know who to contact. You need to know who key officials are. And that's why it's important to have platforms like this so that you can get to know faces, get to know names, especially if you've got in-person engagements. You need to know what information is vital to share. Timeliness is extremely important, especially with a disease like rabies, where you need to get people to get post-exposure prophylaxis as soon as possible. Your follow-up and outbreak investigation is really important. And as I said, regular meetups really help to establish professional relationships so that you know who to call in times of crisis. We've seen as well that individuals can make or break a collaborative effort. So basically, it's just good news if you are keen to drive One Health and to be an effective person, you can make a huge difference where you're functioning. So individuals that are willing and keen to get the job done can make a very, very big difference when it comes to One Health. This also speaks to dedicated drivers when it comes to disease control programs. You need human resources and you need to support them and make sure that you choose the correct person for the job, that they are dedicated to do their work. Altogether, the purpose of this is to deliver better service to our communities when we use the One Health approach as a multi-sectoral team to make sure that you cover all these different aspects in keeping a community safe and healthy. Okay, so just in conclusion, like I said, probably the best example of One Health in action is rabies control, but then definitely also our food safety forums at provincial level. We do need to focus on strengthening our One Health collaboration, especially at provincial level. And then also there's definitely a place for simulation exercises or joint awareness days so that we can ensure that our One Health collaborators know each other and that they know how to work together. And as always, we need to work on strengthening effective communication. Okay, thank you.